Hello, and welcome to our special presentation in our QPP series on the MIPS Promoting Interoperability Performance category. First, I'd like to inform you that the information contained in this presentation is for general information purposes only. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability with respect to content. My name is Laura Wright, and I'm a Quality Improvement Advisor here at the Kentucky Regional Extension Center, and I'm happy to be providing the content for you in today's session. For those of you not familiar with the vast array of services we offer, we have provided them here. The Kentucky REC is an outreach arm of UK Healthcare, and we partner with healthcare organizations across the state to provide guidance around a host of regulatory programs as well as quality improvement initiatives. First, let's just jump right into the Promoting Interoperability Performance category by providing an overview of the category itself. First, the category carries a 25% weight overall, and there is an automatic reweight for all clinician types except physician. So what this means is, let's say you're a nurse practitioner, you do qualify for that automatic reweight, and if you took that reweight, then that 25% weight would be redistributed to the quality category of the MIPS program. As far as measures are concerned, there are 4 main objectives that you must report on, including performing a security risk assessment. And there are a couple exclusions available for HIE and e-prescribing, which we will cover a little bit later. One major requirement is that you must be using a 2015 certified EHR. You have a few different options as far as your submission goes. You can log into the QPP portal and attest to all of the measures. You can log into that portal and upload your information using a QRDA3 file, or you can do a direct submission through an API, and usually that's through an assistance with your vendor. And then finally, the way that the category is scored is it is based on your performance. So basically, seeing what your performance rate is based on your numerator and denominator information that you submit. This just provides an overview of all of the objectives and measures that are required in the category. We're going to dig into each of them in a little bit more detail shortly, but just as a brief overview, we have e-prescribing, which includes the e-prescribing measure as well as a bonus measure for querying of a prescription drug monitoring program. In Health Information Exchange, we have 3 measures. The first is support electronic referral loops by sending health information. The second is supporting those electronic referral loops by receiving and incorporating health information. And then a new optional measure for program year 2021 is the health information bidirectional exchange. And again, we'll dig into that in a little bit more detail shortly. Our third main objective is the provider to patient exchange, where you are providing patients electronic access to their health information. And then finally, we have 5 options available under the public health and clinical data exchange objective, and you will choose to being in active engagement with 2 of those options. As I stated earlier, you must also perform a security risk assessment or analysis. This means that you do have to complete this SRA at some point during the calendar year in which your performance period occurs. So basically, for program year 2021, this must be performed before the end of 2021 calendar year. You must complete the SRA in order to earn any points in this category, although it is not scored. So you don't earn any points, but if you do not perform your SRA, you will receive a 0 for the complete category. So let's dig into all of the different objectives and measures. First, we're going to start with electronic prescribing or e-prescribing. This is where you are prescribing medications electronically. That is your main measure within this objective. It is worth 10 points, and there is an exclusion available if you prescribe fewer than 100 prescriptions during the reporting period. If you are able to take that exclusion, then your points would be redistributed equally to the HIE measures 1 and 2. Also, I mentioned within this objective, we have a bonus measure. That is the Query of Prescription Drug Monitoring Program. In the state of Kentucky, that program is CASPR, and so in order to receive these bonus points, you must attest that for at least one controlled substance that was prescribed electronically, that you queried CASPR. And if you can attest to yes, then you would receive 10 bonus points for that. So looking a little bit further into e-prescribing, we're going to, for each of these measures, we're going to look at what makes up your numerators and denominators, and then any other additional information that might be helpful for you. So your denominator for e-prescribing is just simply the total number of prescriptions that were written for patients. And this does include scripts written on paper, because hopefully you are at least documenting those electronically, that they were written on paper. Then your numerator is just the number of all prescriptions that were actually written and submitted electronically through your certified EHR. You have the option to include or exclude controlled substances, and your cert formulary must be active. And as a side note, exclusions from your denominator include durable medical equipment as well as over-the-counter medications. Our next objective is the provider to patient exchange. Again, this measure is where you are providing timely access to patients' health information. This measure is worth a maximum of 40 points. There are no exclusions available, and so that means there's also no reweighting available. You must attest to this measure. Looking at the numerator and denominator for this measure, your denominator is simply the number of unique patients seen during your entire performance period, and then your numerator is the number of patients that were provided access to view, download, or transmit their health information, which is typically they have signed up for your portal, essentially, or they've been able to access their health information using an application of their choice. And that is through using your API or application programming interface functionality, which we will cover in a little bit more detail in the next slide. Some additional information is that access to their health information must be provided within 4 business days of their visit. You must have your vendor API activated, and patients do have the option to opt out of your portal. If so, hopefully either your EHR is documenting those as opting out and are including those in your numerator, or you can manually count those patients as long as you are providing them with instructions on how to access the portal in the future if they change their mind. So to dig into that API or application programming interface a little bit further, we've provided this additional information. The best way to describe an API is to use an example of booking travel. So if any of you have gone onto Expedia or Travelocity to book a flight, you know that you can go to that one website, put in your information on where you're going and your dates, and then the website will actually go out and query all of the airlines and bring you flight information on several different airlines, instead of you having to go out to their individual websites and searching for flights yourself. So then compare that to the healthcare world. An API is the functionality that allows a patient to use one application to pull all of their health information from the different organizations where they see providers. So it is going out and querying their portals at the different organizations and pulling it into that one application for the patient's ease of use. There are a couple of requirements around the API, and that includes that providers may not prohibit patients from using any application that meets the specifications of the API. And the providers are expected to provide patients with instructions on how to authenticate their access through the API. So similar to your instructions on patients accessing your portal, you need to have instructions on how a patient can leverage the API to access their health information. Moving on to health information exchange, this objective looks a little bit different for program year 2021. So we're going to start with measure 1, and that is the support electronic referral loops by sending health information. That is where you're generating that summary of care and sending it electronically. It's worth 20 points. And then measure 2 is support electronic referral loops by receiving and incorporating health information, and that is also worth 20 points. And then new again for this year is this optional HIE bidirectional exchange. If you are able to attest yes to this third optional measure, you would receive your full 40 points for this objective. There are exclusions available for measures 1 and 2, and that is if your denominator is less than 100. You could exclude from either one of those measures. So let's look at those numerators and denominators for each of these measures. Starting with HIE send, your denominator is the total number of transitions or referrals that you had during your performance period. Your numerator is the number of transitions or referrals in that denominator where you created and sent a summary of care record electronically using your EHR. Some additional information to consider is that the referring clinician must have reasonable certainty of receipt by the receiving clinician, and that receiving clinician must be able to incorporate that summary of care document electronically into their certified EHR. So essentially that means you might generate your summary of care electronically, but then it also must be sent electronically. You can't drop it to fax and then fax it to that receiving provider. For HIE receive and incorporate, your denominator is the receipt of electronic summary of care records that you have received or you have gone out and queried and pulled into your EHR for any referrals or transitions of care. Your numerator is when you have completed the clinical information reconciliation for medications, medication allergies, and current problem list from that summary of care document. The actions must be completed during the performance period, and CMS understands that sometimes no update is necessary. So if that information is going to be duplicated or it already exists, then reconciliation can simply be verifying that the information is already in your EHR. And then finally, this third new optional measure, you will simply report yes or no. For this, there is no report necessarily that you will have to run in order to get numerators and denominators. You will report yes if you are able to attest to this measure. If you report yes to this measure, it is required for your total PI performance category score if you're saying that you're using it as an alternative to measures 1 and 2. And then just keep in mind that there will be attestation statements that you'll have to attest yes to, essentially saying that you are engaged in bidirectional exchange with an HIE in order to support transitions of care. And then finally, we have the public health reporting measure, where you are reporting that you are in active engagement with at least 2 public health registries. If so, you will receive the full 10 points. There technically are some exclusions available. However, particularly because we have the Kentucky Health Information Exchange, which can help you meet this requirement, the exclusions are not applicable to our Kentucky clinicians. If for some reason you practice outside of the state and are listening in, and you're able to take one of those exclusions, your points would be redistributed to the provider to patient exchange objective. So since I mentioned KHI, I just want to provide a list of the different options that are available under public health reporting, and then listed out some ways that you can satisfy those requirements. So under this objective, we have the immunization registry, syndromic surveillance, electronic case, public health registry, and clinical data registry. And as you can see, if you utilize KHI, you can essentially meet 4 out of these 5 measures. And then we've also provided some other ways that you can help meet this objective outside of KHI, such as using a qualified clinical data registry or there is also a National Healthcare Surveys registry through the CDC that is available. And then putting a plug in here for KHI, in case you have further questions or need support from KHI, you can find your county on this map and determine who your outreach coordinator is and reach out to them, because not only can KHI help you with the public health registries and reporting, but they can also help you with other measures, such as utilizing direct secure messaging. Now, since I did mention that there are a couple exclusions available where points are reweighted, we thought it would be a good visual to kind of show you where some of those points could be redistributed. So starting with electronic prescribing, if you were able to exclude from that, your points would be redistributed to measures 1 and 2 equally for HIE. So 5 points would go to HIE send and 5 points to HIE receiving. Now, if you were able to exclude from HIE measure 1, the sending health information, your points would be redistributed to provider to patient exchange objective. And then if you were able to exclude from measure 2 for HIE, the receiving health information, your points would be redistributed to measure 1 of HIE, the sending health information. And then again, if you are outside of Kentucky and claim an exclusion for public health reporting, those points would be redistributed to provider to patient exchange. So ultimately, the main message here is that if all of these exclusions were taken, then the provider to patient exchange objective would carry all of the weight for this category. So it would be extremely important that you scored well for that objective. Finally, I do want to mention that there are some promoting interoperability hardships and reweighting available. So if you are an EC in a small practice, you're using decertified EHR technology, you can prove that you have insufficient internet connectivity. You are subject to extreme and uncontrollable circumstances, which that's typically natural disasters and things like that, or you lack control over availability of your cert, you can apply for reweighting of this category. What that essentially means is that if approved, your 25 points for this category would be reweighted to the quality category. And as I mentioned earlier, there is some automatic reweighting based on special status and clinician type. So for instance, again, if you're a nurse practitioner, then there is an automatic reweight to where you do not have to report for the PI category. However, look at your performance. If your performance is very good, you can still submit for the PI category. And then finally, as a reminder, groups and virtual groups must qualify for reweighting unless the group has special status that qualifies for reweighting. Thank you so much for tuning in today. We have one more video we'll be releasing on covering the cost performance category, so look for that coming soon on our website. Please reach out to us if you need anything or have any questions. We love to help and we would love to connect with you. Thank you.